Okay, everybody, so we're at Laguna Pollo. We're at a beautiful place that we rented for a month, and kind of words traveled that we're doing some acupuncture. And so we had some friends come over and needed a treatment. And so I just wanted to kind of run through what I was doing. We've had a lot of knee pain. There's been some reconstructive surgery on the knee. The right knee, very, very sore, a lot of pain. There's some degenerative arthritis and a lot of pain in the spine and the back as well. So I needed to attack both those. So I used a series on the back, Lingu and Dabai, really good in terms of large intestine, which will treat the kidney meridian to help with the back pain. I used Sanchisan for the gallbladder to help in terms of like the hips and to deal with, so it's Sanjiao and it'll deal with gallbladder. Small intestine series to help in terms of deal with its the up-down pair of small intestine to bladder for the back. I've added in a couple of points on Sanjiao and large intestine. Again, large intestine for the back pain. The back pain kind of moved and played a little bit, so I just kind of chased the pain a little. I used San Gutsa, so I used these on large intestine, touched the bone to make sure that I caught the tissue extension of the kidney. I've used kind of a lung 5 series on Tai Yin to catch Tai Yong for the back. It'll catch low back and upper back really well. Because there's overall joint pain, Muguan and Guguan are quite good for this because this one's in the heart, this one's in the lung. So heart will catch kidney, lung will catch spleen aspect for dampness. So you've caught aspects of problems with the joint of the bone extension, which is kidney, and for the lung, which connects with spleen. So the spleen is the dampness. So you got the fluid in the joint and the actual bone itself. So it helps treat those, and they're very good for overall joint pain. I did a couple of local points in the knee, eyes of the knee, stomach 36, kind of a modified spleen 9 where there was pain, just to help with that. I've added in some kidney points to help tonify overall. I've kind of used my yin-yang cross here, 7718, and I just used a couple of guide points in terms of gallbladder and bladder just to help clear out some of the pain through the back. So that's kind of one thing that we've done. I might, in the subsequent treatments, use some local electric stim on the knee just to kind of clear that up, but I wanted to go slow. This is first one, and we're sort of, baby steps in here. Because we're a little bit remote, we've rented a place in a volcanic lagoon, like way out in the middle of nowhere, and so it's going to be tricky to get to us for a hot minute till we get the clinic set up. But we're going to give some instructions to do some tuina on her own, which is really going to help. And so obviously the goal here is to kind of empower people to be able to help themselves and stop some pain. So it's a really good challenge in terms of A, language, but B, in terms of getting creative of like, how are we going to attack this with the least number of needles, because they're tricky to get. B, what can we do to help in terms of like build up the ability for the treatment and the effectiveness of the treatment for home care. So I think we're going to use a lot more like teaching of tuina, which is really good. This is the kind of stuff that we're going to be playing with when we're out here. So if you want to come and visit us in Nicaragua, good idea. All right, till next time.